Before coming into the patient's room, I'd wash my hands and gather all my equipment as I have here. Okay, knock on the door. Hi, I'm Ashton. I'm going to be your nurse today. Can you state your name and date of birth for me?
Grace, December 14th, 1995.
Okay, and is calling you Broman okay, or do you prefer to be called something else?
That's fine.
That's fine. Okay, can you tell me where you are today?
Hendrick Medical Center, Abilene, Texas.
Okay, and what are we doing here today?
Here for a physical exam.
Physical exam, and it's okay if we proceed with that?
Yes, ma'am.
Okay. Who's our President of the United States?
Donald J. Trump.
Okay, so patient is alert and oriented ×4. Next I would do vital signs. Are you in any pain? If you had to rate your pain on a scale of 0 to 10, with 0 being being no pain and 10 being the worst pain you've ever experienced.
No.
No pain at all? Okay, do you mind telling me your height and weight?
About 5'11", about 205 pounds.
Okay, so patient looks similar or exact to stated height and weight. Male, African American male, appearance as stated, ethnicity, facial expression is appropriate to the situation. Build is muscular. What else? Okay. There's no, I don't see any lesions, lumps, masses, all that good stuff. So I'm going to tell you 3 words, and then in a little bit I'm going to ask you to repeat those words for me. Okay? So red, car, and ball. Okay? Okay. Patient's hygiene is clean cut, no breath odors or body odors. And patient's gait was, do you want to set up something again? No? Okay. Patient was able to walk in, sit down on the table, so gait is present and fine. Okay, can you repeat the 3 words that I said to you?
Red, car, and ball.
Red, car, and ball. Good job. Short-term and long-term memory intact. Okay, we'll get started with the exam. I'm gonna get this off real quick because I keep looking at it. Okay. Okay, so first we're gonna start with your head. His head looks symmetrical. Skin color is uniform. Hair distribution is even. No bald spots or lesions, abnormalities. Presence of lice is none. Eyes and ears are symmetrical and even to the appearance of the face. And can you puff out your cheeks for me? Okay, now can you smile? Can you frown? And then can you squint your eyes tightly shut? Tightly shut. Okay, you can open up. So cranial 7 is intact. Okay, so next I would inspect the eyes. So the eyes, there's no drooping. Sclera is white, shiny white. Pupils are equal. There's no displacement of the pupils or the iris. The conjunctiva, can you take and lift your top eyelids up for me? Okay, and now can you do the bottom ones? Okay, the conjunctiva is pink and moist. Sorry. And eyebrows are in line, even to the face. Again, no drooping of the eyelids or the under eyes, no swelling, no edema, no displacement of the eyes. Okay, so now I'm going to test what we call a corneal light reflex, and it's just where you look at me, and I'm going to shine this in your eyes and look for the reflection of the eyes to see if it's even. Okay, so in a second, look at the light whenever I need to. Don't move your head, just keep your head still, okay? So just keep looking at me. Why is it not working? Please don't be dead. Sorry, we're having a malfunction.
It's okay.
Is that better? Did that look brighter a while ago? Okay, so I'll just hold it closer. Okay, so just look straight. Just look straight at me. It went off again.
I think you may need to unscrew the top and change the battery.
Unscrew the top. What kind of battery? Oh. Okay. Hold on, I gotta get a battery for this pen. What are these odds with this happens? Haha. Okay, so we're back. We're working. Okay. So like I said before, just look just look straight at me, and I'm gonna shine this light in your eyes. Okay, so corneal light reflex is equal in both pupils and intact. Good. Okay, so next I'm going to test your cranial nerves 3, 4, and 6. Do you have any questions about what those are? No? Okay. So what I'm going to need you to do is just follow my pen without moving your head. Okay, so keep your head still, just move your eyes. Okay. So cranial nerves 3, 4, and 6 are intact with no obvious nystagmus except for extreme lateral gaze. Okay, I'm going to have you look behind me, and I'm going to shine the light in your eyes again, but instead of looking for the reflection, this time we are going to look at your pupils. Okay, so just look at an object behind me. Look, sorry. Right behind me. So don't move your eyes. Okay? Okay, pupils are equal and reactive to light. And then again, can you look behind me without moving your eyes?
Yes.
You're looking behind me? Okay, now look at my pen. Okay. Sorry. Eyes are equal, round, reactive to light, and accommodation. So that means you're all good. And then next I would do this. The visual. This is going to test your sight, your vision. Okay. So what I need you to do is hold this about right here. Okay. and then I need you to cover one eye and read the smallest line that you can.
42670
Oh,
EWM.
sorry, just the numbers.
Okay.
Yes.
42670.
Okay, and then now do the other eye.
Okay.
Cover the other one. If you need to take a second to blink, you can, and let your eye adjust. You can do that.
42670.
Thank you. Okay, so patient has 20/20 vision, visual acuity 20/20. Excuse me, sorry. Okay, so now I'm going to inspect your ears. Okay, so just upon inspection, there's no drainage. Ears are equal on the face, even with the line of the eyes. There's no redness, no lumps, lesions, or abnormalities. Do you have any pain in your ears, internally or externally?
No.
Okay, so next I would inspect the nose. So nose is midline, even, symmetrical to the face, not too small or too big. It's, like I said, even to the, sorry, this is my eye. Even with the other facial features. Okay, so can you tilt your head back and pull your nose, pull the tip of your nose up, kind of like a pig nose, but not extreme. Okay, put your head down, maybe not that far. Okay. Okay, so septum is midline. There's no drainage. Inside of the nasal cavity is pink and moist. Do you have any pain in your nose?
No.
Or up in your sinuses?
No.
Okay. So now what I need you to do is close your eyes. I'm going to test your cranial nerve 1, and that's your smeller. It helps you smell. So I have a odor, I guess. It doesn't stink. That I need you to identify. Okay, so first, can you occlude one side of each nostril and breathe in so I know that? Thank you. Okay, so now close your eyes. Okay, are you ready? Just keep breathing around with this under your nose. Can you tell me what that is?
Smells like vanilla flavor.
Vanilla flavor, that's right. It's vanilla extract. So very good. So cranial nerve 1 isn't, sorry, that was, that was strong, sorry. Cranial nerve 1 is intact. Next, I want to inspect your mouth. So lips are symmetrical to the rest of the face. Mouth isn't displaced to one side or the other. Lips are pink, plump, not chapped, no cracking. Do you have any pain in your mouth? Okay, so now if you will please open your mouth. Okay, can you lift your tongue up for me? Thank you. And then put your tongue back down. Okay, do you need a break?
Yes.
Okay.
Yeah.
Okay, so the buccal mucosa is pink and moist. Tongue and gums and teeth have no abnormalities. The inside of the mouth is, again, pink and moist. No cavities on the tongues. No swelling, no white patches, lesions, lumps, tonsils are grade 1. So now I'm going to test cranial nerves 9 and 10. Okay, so what I need you to do is open your mouth again. Real wide. Can you put your tongue down? There you go. And say ah. Okay, so uvula retracted. Both, I guess, the soft palate rose. Yeah, pharyngeal rise. Now I'm going to do cranial nerve 12. So what I need you to do is stick out your tongue straight and then move it to one side and move it to the other. Okay, the patient was able to stick out their tongue. You can put it back in your mouth. And move it to both sides with ease. The cranial nerve 12 is intact. Okay, so now we're done with the inspecting, so now I'm going to palpate. I'm going to feel. I'm going to feel all your head and all this stuff. Okay, so if you don't mind putting your head down for me. Okay, so I'm palpating your skull just to feel symmetry, if there's any lumps or lesions. Not lesions, if there's any lumps or masses. There does not appear to be any lumps or masses. Skull is symmetric all the way around. No abnormal bulging. Did that hurt whenever I was palpating your skull? Okay. Again, no lice present. Hair distribution is good. So now I'm palpate your temporal arteries. Okay, so just relax. Sit here. Temporal arteries are strong bilaterally, so 2+. Okay, now I'm going to test cranial nerve 5. So that's with your jaw. Okay, so if you don't mind clenching your teeth for me. Unclench them. And do it again. Okay, now unclench them. And open your mouth for me. Close it. And one more time. Okay. Now do the same thing. Close it. Okay, cranial nerve 5 intact. Did any of that hurt when I did that? Do you have any pain? Okay. Now I'm going to palpate your sinuses. And you said you didn't have any pain in your sinuses right now? Okay, if you experience any pain, let me know. Just keep looking forward. Both maxillary and frontal sinuses, there was no pain reported upon palpation, and
Apologize.
no, that's okay. Okay. No pain was reported, and no swelling was felt. So sinuses were not palpable. I apologize. We're going to go back to your ears, okay? Okay, so now I'm going back to palpate the ears. And I'm going to just feel around your ear. Let me know if you have any tenderness. So we have the helix, the antehelix, the tragus, and then the lobule. Does any of that hurt while I palpate that? Okay, no tenderness was reported. No masses were discovered. Sorry.
Okay.
Did I get you?
No.
Okay, so now, okay, do you need to take a minute to scratch it?
No, it's okay.
You sure? Okay, so now I'm going to test cranial nerve 8. So what that is that is your hearing. So I need you to cover one ear. I'm going to lean to one side and whisper 3 words, and then I need you to repeat them back to me. Okay, so go ahead and cover your ear.
1, 2, 3.
Okay, now do the other side for me.
1, 2, 3.
Yes. Okay, so cranial nerve 8 is intact.
I thought you said to the 2.
That's what you thought I said?
Yeah.
Well, you said it right, so you did
Okay.
good. Yeah. Okay, so now we're done with your head. We're going to move to your neck. You need to yawn. Okay, so if you don't mind just putting your head up slightly for me. Not fully up. There you go. Okay, so trachea is midline. There's no swelling. Skin color is uniform. Can you swallow for me? Okay, trachea rose and came back down, for lack of better terms. Midline and even. There was no distortion of the trachea. Like I said, no swelling, so no goiter, lumps, lesions, skin color is uniform. Now I'm going to do 11, cranial nerve 11. Can you move your head side to side? Okay, and then can you do flexion and extension? This is also testing range of motion as well. Okay, you can put it down. And then bend your ear to your shoulder and your other one. Okay. So range of motion is full. Now we're gonna do cranial nerve. Okay. So can you shrug your shoulders? Okay, you can put it back down. And then turn your head against my hand and back. And then turn it the other way. Thank you. Okay. Now I'm going to palpate the lymph nodes. Okay, I'm going to just feel on your neck, okay? So we have the preauricular, postauricular, occipital. Okay, you can push your head down if you need to. That's uncomfortable. And then the inferior, post-cervical, cervical, submandibular, submental, and then the tonsillar. We have the supraclavicular and the infraclavicular. Does that tickle?
Yeah.
Okay. Did you have any tenderness while I was palpating?
No.
Okay. Now I'm going to palpate your carotid arteries. And I'm going to do that one at a time.
Okay.
You know why? Because if I do it both, you'll pass out.
Oh.
Okay.
Yeah.
So I'm going to do it one at a time, okay?
Okay.
Okay. I'm going to do your other one. Okay. Carotid arteries are strong, +2. Now I'm going to listen to your carotid arteries to make sure there's nothing going on there. But I'm going to clean my diaphragm. That way you don't get sick. Okay. So just keep breathing normally for me. Now listen with the bell of my stethoscope. Okay, now I'm going to listen to the other side. Okay, so no breweries are present upon auscultation of the carotid arteries, so that's good. You don't want to have bruise. So now we're going to move on to your chest and do that.